What do you mean when you say AIDS is a lifestyle disease?
Well, I would not say that now. I may have at one time. I need to qualify it. Basically, my view on AIDS has changed, but I have regarded it for a long time as a phony construct, meaning that there really is no such thing as AIDS. It's not a coherent disease entity. All we really have are diagnoses of various kinds, which have changed a great deal. But originally the question was why a few gay men, a very tiny subset of gay men, were getting sick in ways that were called AIDS. This would be back in the early 80s. And I thought that I could perhaps help there because I had been a gay activist since 1969, and I also had expertise as a survey researcher. So I read all of the literature on AIDS, and at that time there were many hypotheses. But it looked most reasonable to me to expect that some sort of drug, toxins, were what were causing it, because AIDS was not then and never has behaved in any way like an infectious disease. And there were certain drugs which were almost peculiar to a certain subset of the gay lifestyle. The main one being poppers, which for some reason was almost never used at all by straight men, but was used very heavily by gay men. Well, originally poppers were amyl nitrite, a prescription drug, which was used for emergency relief of heart pain. And they were used primarily by elderly people with heart problems, and then only in case of an emergency. But a very few gay men, mostly those in the leather scene, started using them. They found that they enhanced orgasm, basically. But then after Stonewall, after 1969, there was a explosion of gay industries of all kinds. Yeah. Poppers, an industry developed around them, which actually made it, $50 billion a year or more. Instead of the old poppers, which were little ampules, they were glass and they were popped with the fingers under the nose. They were in little bottles, and they were other forms of nitrites, but all very similar, called the alkyl nitrites. They would be butyl or isobutyl or some other form of nitrite. They had similar effects. But at any rate, it occurred to me that this might be one thing that was leading gay men to become sick in ways that they were. It was just a guess. But I started working with Hank Wilson in California, and I discovered there was a very extensive medical literature on the volatile nitrites. They are very, very bad indeed for the health. In fact, I should probably describe what they do, the toxicities. The simplest thing is that they're very powerful oxidizing agents, which is bad. Poppers cause severe anemia, in fact, several types of anemia. And secondly, poppers are powerfully mutagenic, meaning that they cause cellular changes. And this is bad news because substances that are mutagenic are almost also carcinogenic. So at any rate, Hank Wilson and I tried to get the word out to gay men. We had a hard time because gay publications were all running, every issue, a dozen ads for poppers. This was a large part of their revenue. And there were only, a few gay publications that would even print a letter from Hank or me, let alone an article. But eventually we published our little book, Death Rush, Poppers and AIDS. And the word started to get out. They're still readily available, but I think that not nearly so many gay men use poppers now as used to. The studies, if you looked at them, yes, and true, there were none of the early AIDS cases who had not used poppers. But I've done my own independent research, which I describe in the AIDS War. One of my informants, Artie Felsen, who was very, very active and outgoing in the People with AIDS Coalition, claimed that he had interviewed several hundred gay men with AIDS. And he said that virtually all of them had been heavy users of drugs. But he said without a single exception, they had all been poppers users.
Now in 1983, the CDC announced that they had done studies which showed that poppers were safe through a mice study.
Yes, there was some like that, utterly fraudulent, more fraudulent in the conception really than the execution. But they again assumed that poppers were used as room odorizers. And when you have such a totally dishonest assumption to begin with, everything else that falls will be equally fraudulent. With any poison, the dose is important. I mean, we could drink cyanide if it were a very, very, very diluted dose, and it might even be good for us. But, again, with any poison, the dose is important. And no, the doses of the mice we're exposed to, might not have been 1/1000th what gay men would get in the course of a single evening. My position from the very beginning, from my first major AIDS article in 1985, was that toxicology was the answer rather than microbes and infectious agents. In the case of intravenous drug users, I've analyzed this in considerable detail in my book, my articles in the AIDS War. But it's very clear that they are getting sick from the drugs themselves, and furthermore, they're getting sick in exactly the same ways they were getting sick 100 years ago. For example, among the opiates, heroin and so on, one of the leading things is pneumonia and tuberculosis, lung problems. And this is perfectly obvious because heroin not only wrecks the immune system, but also it suppresses lung function, which is why codeine is used in cough syrup, or it used to be. So the question is, with all of the emphasis on clean needles, to take the very simplest of all things, and as a survey researcher, I would tend to think of, the simplest thing should be done first. Did they or did they not share needles? And I asked all of the public health people I could. I called Washington, I talked to them in New York. They all seemed to think there was a study showing that they shared needles, and yet, in fact, there never was one. There have been studies since then, quite a few, not on whether they shared needles, but on whether those who used clean needles came down with diagnoses of either HIV positive or AIDS. And some of those showed that the rate is far higher among those who used the clean needles. In other words, somebody who injected heroin always using clean needles, some of the studies, they were much more likely to be HIV positive, which indicates clearly that whatever it is that the so-called HIV tests are measuring, it has nothing to do with the real virus. Whatever causes the antigens in the body that the test in one way or another measures, they have a lot to do with things like drugs and other stuff, past infections, and probably nothing at all to do with a new virus. As far as what the government policy should be toward drugs, I don't know. I mean, I think the present policy is about as bad as it could be. But certainly they should be told the truth. So it's not fine and dandy to inject heroin with a clean needle. And the same could be said about all of the other gay drugs. The emphasis of the Public Health Service has always been that sex is the most dangerous thing, that sex is the cause of HIV infection, all of which there's no proof for, but that all of the other stuff, that you should only worry about intoxicating drugs because they might make you forget about safe sex. In other words, if you were schwacked out of your mind on some sort of drug, you might forget to use condoms. Well, in fact, all the evidence we have is that the drugs are what make people sick in ways that were called AIDS, and that sex itself is, I would say I don't know of any study that even shows that sex per se is a risk factor. Now, this would involve using certain types of statistical analysis, multivariate analysis and other types, to isolate the various variables to show how much each one of them contributes. And that's a whole other thing which gets rather technical. From the very beginning, you know, all of the efforts of the government public health service were determined that it should be an infectious agent long before they came up with one. At a certain point, of course, things go on to a different level, and you have the enormous investment of the medical industries and also of all of the various researchers with their reputations at stake. You know, you think how devastating it would be if the truth about AIDS came out. And the truth, of course, is that there really is no such thing as AIDS as a disease entity. And secondly, that HIV, if it exists at all, and I think it's rather doubtful that it does, is not causing illness at all, let alone, you know, AIDS. And third, that the drugs used, the HIV drugs, are killing people. So if there have been 500,000 people in the United States, whatever it is now, that means virtually 500,000 of people that were killed by drug toxicities. So all of that, it's not too surprising when you think of all of the reputations of thousands of people, when you think of billions of dollars, not only that the drug companies and other industries would not have, but lawsuits. You know, it'd be quite catastrophic if the truth ever came out. To comment on the very earliest AIDS cases, there was a great deal of dishonesty in the very beginning in the way they were reported. For example, they described the first, not just the first 5, but say the first few dozen AIDS cases as being young and previously healthy. And this was not true. The average age of the first few dozen AIDS cases was 38, which is a lot younger than I am. But on the other hand, it's not, you know, it's not really young. Someone who's 38 years old has had enough time, 10, 15 years, exposed to a highly toxic, well, I don't know the word lifestyle, included to many toxic, harmful, things harmful to the health, for them to become sick in one way or another. Secondly, they were not previously healthy. The data have been re-examined of the early AIDS cases, and hardly a single one of them, but had been really quite sick for a long time. Some of them were congenitally sick. They had been sick for their entire life. But they, you know, to say previously healthy is a grossly misleading term. And again, this is not an accident. Paul Fulberding, one of the leading so-called AIDS experts, reported on one who had been, you know, deathly sick all of his life, and yet he referred to them as though giving the impression that he'd been perfectly healthy before he came down with what was called AIDS. From the first so-called case control study, they gave the impression that the only important thing was what they called promiscuity. And they, even though they showed that the guys with AIDS diagnoses had used an enormous amount of drugs, they considered that irrelevant because the so-called cases with AIDS and the so-called controls, they couldn't find a statistical difference. Well, in fact, the people they used as controls were, you know, pretty sick cookies, and many of them came down with AIDS later. Yeah, it was a grossly inappropriate study design. But even here we get, again, it's not that they had good intentions but made a few mistakes. It's clear dishonesty. For sex, they used the mean, the arithmetic mean. So if you had someone with 1,000 sexual partners per year and someone with 1 sexual partner per year, or 0, you would get an arithmetic mean of, like 500. But this is grossly misleading. I mean, you have to show in statistics the whole distribution, and you have to show measurements of what's called dispersion and various other things. But you don't just simply pop out one figure, the mean, and let it go at that, which is what they did.
Was the approval of AZT based on high quality clinical trials?
No, certainly not. I went through, probably several hundred pages of documents released under the Freedom of Information Act of what were called the Phase 2 trials. And the Phase 2 trials are supposed to show that a drug is both safe and effective. And it became clear that there was not all sorts of sloppiness there. But at one point, they had freely admitted that they had used data. They had used data that they knew were false. So I'm a professional researcher. I know immediately that this means fraud. You cannot use data that you know are false without committing fraud. But the question of how the fraud was done, I had a hypothesis, which turned out fairly well to be correct. But they claimed that these very startling differences in mortality in only a short time period. I forget what the figure was, 19, I think, people in the placebo group died, and only, one on ACT died. This is utterly impossible, considering that all of the other aspects of the study showed no benefits whatever to ACT. I mean, that would be a true miracle. Well, there's a lot to go into it. I've analyzed the study pretty thoroughly, and I think that what I wrote is available on the internet now. It gets kind of technical because I'm analyzing survey research, which indeed the trials were. But I eventually found there was a study investigating the Boston group at Mass General Hospital, where the FDA investigators found blatant fraud and issued a report on it. And they recommended that all the data from the center be excluded from the study. It turned out the FDA used all of this data, all of which was total garbage, fraudulent. And they used the justification that it wouldn't change the results much, which, right here, that you're dealing with criminal fraud. Anyone who could use a rationalization like that. But I fought for many months to get a copy of that report. I would not have gotten, I got the runaround, yes, we have it, no, we don't have it, it's here, no, it's there, it's disappeared, there's no such thing. I got all sorts of contradictory answers. But I found something which is highly unusual. I found one single honest woman in the FDA, and she went to bat for me. And there were even at some point, there would be a conference call where I would be on the line and she would be on the line and some FDA officer would be on the line. And she said, now I would like you to hear what she has to say. And this woman would claim, that there was no such thing, was lost, whatever. But finally I did find it, and it was quite something. I mean, it explained very concretely the most incredible type of cheating that took place in Boston. Well, I can go into detail, but anyway, in my book, the AIDS War, I have a chapter on this describing, all of the details of what was found. Well, it was by no means a double-blind placebo-controlled, because almost immediately patients and doctors both knew who was getting what. But this pales in the insignificance with the other types of fraud that were there. But since you're on it, let me say that I spoke to Margaret Fischel, the primary author, at length, and I recorded it. I didn't tell her I was recording it, and perhaps I should, but I regarded something of this importance, where lives are at stake, that you can bend things a bit. But the woman was, you strike that. Margaret Fischel could not answer my simplest questions about the study. She could not explain tables there. She could not explain statements that she herself allegedly had written. She just kept saying over and over that if I wanted answers to my questions, I should call Burroughs Wellcome.
And who was Margaret Fischel?
Margaret Fischel was the leading investigator of the Phase 2 trials. She was the primary author in the New England Journal article. The study fell apart. I mean, it bombed in so many ways. I showed the article, I wrote on it to my colleagues in survey research, and they were absolutely struck dumb. They could not believe the levels of incompetence that were there at all different levels, including things that are purely mechanical, but like the ability to design an appropriate questionnaire form. But yes, of course, a drug which is supposed to be given for the rest of somebody's life, if you have something tested for only a few weeks, you have a very poor idea of, what to expect from it. Especially the Boston study, they would claim someone was in much longer than was claimed on the case report forms. And this meant that simply the doctors received a great deal more money. But far more important than this was the reporting of the adverse effects, the toxicities. And this was, the heart of what the study was to measure, that it was safe. And many of their patients would have died from the toxicities of AZT if they had not been given emergency blood transfusions. This is serious adverse effect. It means literally that they would have died from the poison. And yet the case report forms, which showed up eventually as official data, they would report no adverse effects. I mean, this is a type of dishonesty. It's hard to go any further than that. Almost immediately, I knew that it was fraudulent, and I thought how stupid these people are. If you're going to commit fraud, do so more subtly. And of course, eventually I found out, all types of fraud, and there's probably more than I did find out. This is a different take, but to me it was the stupidity of the crooks that they couldn't even put up a convincing statistical front there.
How come the 19 people in the placebo died versus the only one AZT patient died?
Well, this is a fiction. I mean, I can't explain something that's not true. Well, the most outrageous case, I forget which one it was, but was someone who had already been taking AZT, which a few people could. They wanted the new miracle drug, and they were able to get it before it was approved for marketing. And he was entered as a patient in the placebo group. Even though he was still taking AZT, he dropped out almost immediately, but continued to take AZT, and then he died. And they called him a death in the placebo group. I mean, it's hard to cheat any more than that. Of those who were given AZT, they all suffered really severe side effects. Side effect is misleading, toxicities. But a number of them would very definitely have died from anemia, which in the review of animal studies, AZT causes anemia in every species of animal that's ever been studied, including human beings. But they would have died if they'd not been given emergency blood transfusions. And yet, according to the official data, the case report forms, these people had no adverse, reactions. The one single most unforgivable thing, there was cheating. There's no reason to believe that Boston, one of 12 centers, was the only one in which cheating took place. It's very likely that the same cheating, maybe even worse, took place in all 11 others. It's just that Boston happened to get an honest investigative team that did their work. Many of the others were going to be investigated thoroughly, and then they said, we just don't have time. So we don't know. But to me, the single worst thing is that they deliberately used data they knew were false. This, that's the one single thing that can never be forgiven. As with poppers, you go immediately to what is the chemical property of it. And with poppers, they're a powerful oxidizing agent and a powerful mutagen. A case of AZT, it has a very simple effect. It purely and simply, it terminates DNA synthesis in ways that Peter can explain to you. I mean, it substitutes itself for one of the 4 building blocks of DNA and therefore breaks the chain. Therefore, essentially terminates the life process. This was considered a good idea as a cancer drug, since DNA synthesis is involved in growing things, and since cancer grows abnormally fast, if you had something that terminated DNA synthesis, maybe this could kill a cancer before it killed the patient. Good idea. That's the rationale behind chemotherapy. Well, it didn't work that way. In fact, not only was AZT worthless in preventing cancer or in treating cancer, but in fact it caused it. Iatrogenic means caused, an illness caused by medicine, medical practice, or by doctors. With regard to AIDS, there are many iatrogenic phenomena. Certainly the AIDS drugs, not only ACT, but all of the ones after that, including very much the protease inhibitors and all of the other nucleoside analogs, are harmful. And the AIDS drugs, probably since the late 80s, are the number one cause of so-called AIDS. But there are also much more subtly iatrogenic effects going on. I would say, for example, psychologically, I think the devastating psychological effect of getting a positive result on an HIV test is almost enough to kill some people. And certainly it's driven them to suicide. People have been murdered because they had a positive thing. They've been driven into bankruptcy. And I imagine a lot of them just got, deathly sick because of, among other things, they were told they should. Plus the fact, of course, it led many of them to being treated with anti-HIV drugs. But there's so many different things. I mean, almost all of the AIDS phenomenon is, in a sense, iatrogenic. AIDS, once more, is a phony construct. But in the early days, the very early AIDS cases were really quite sick. And there were very good reasons why they were sick, mostly drugs, but not entirely. Some, had been born sick. But then at a certain point, when that sort of AIDS had virtually ceased to exist, there became a new type of AIDS. They expanded the definition, and also they began giving the anti-HIV drugs to people who were, in fact, not even sick, but merely positive on the HIV tests. And in that case, of course, I mean, when they finally became sick enough from the AIDS drugs, then they were called AIDS patients. But here in Massachusetts, this is interesting. In Massachusetts, the number one leading cause of death among people who are HIV positive is liver failure. And I don't think liver failure qualifies yet as an AIDS-defining disease. But these people they're not counted as AIDS cases. They're just somebody who was HIV positive, given AIDS drugs, and the AIDS drugs killed their liver and they died. Looking back, over 25 years, I think I'm probably the longest running AIDS dissident. I began in earnest, well, actually in about 1981, but, in earnest in 1983. And my first major AIDS article was in 1985. So I was, 2 years ahead of Duisberg. And I am involved in other things now, primarily English literature, the English Romantic poets. But I haven't, by any means disengaged myself. But it's hard, I guess I would simply have to say that my main concern is the gay men who have been murdered. And I don't think murder is too strong at all. I mean, when you have drugs like ACT that were approved on the basis of fraud, and which, I don't think murder is too strong a word to use when you have a drug like ACT and all of the nucleoside analogs that followed, more or less on its coattail. approved on the basis of fraudulent research, and where, as you know, as Joseph Sonneman said, AZT is incompatible with life. Well, if it's incompatible with life, it's a poison, and if it's a poison that kills people, in contexts like that, it's murder. It's not easy. I think that AIDS is winding down in a way partly because it's simply become boring. Any effort which goes on constantly to try to drum up still more interest in the latest breakthrough, which of course never is, nobody cares anymore, you know, and want to go on to other things. Yeah, one thing I forgot to mention on HIV testing. Why have so many gay men tested positive on these things? And Christine Johnson has showed that there are 50 or 60 different conditions that can cause a positive result in the tests. Anything from past infections with, say, influenza, malaria, drug abuse of all different types, extreme stress, alcoholism, pregnancy, all kinds of things which have nothing whatever to do with viruses. But one possible hypothesis is that something in gay men is causing them to register positive. That's conceivable, and something like poppers, recreational drugs, is at least a hypothesis. But another thing which is very important is that gay men have been targeted for testing. In other words, the general population of the United States, there has never been the mass pressure, get tested, take an HIV test. But gay men, the propaganda there is everywhere. And so, of course, the more people you have taking the test, the more positives you will get. And to me, this is a very sinister development, or a very sinister phenomenon.
Some people are very fortunate they don't have these side effects. So what